Hello and welcome to Healthafrik on AAU TV. AAU TV is the voice of higher education in Africa. Today on Healthafrik, we are discussing healthcare delivery in Ghana, lessons from the COVID-19 pandemic. And I know you are expecting a continuation of the men's health series. Yes, the men's health series has ended, and this is what we are bringing to you today. And then from next week, we are presenting the Women's Health series, which I know you're very much interested in, so you should keep watching Healthafrik on AAU TV. So when we talk about healthcare delivery in Ghana, a lot goes into it. And I'd like to read something from the World Health Organization with regards to integrated health services. It says integrated health services encompasses the management and delivery of quality and safe health services so that people receive a continuum of health promotion, disease prevention, diagnosis, treatment, disease management, and rehabilitation services. So the question here is, are you receiving all of these with regards to healthcare system in Ghana? You know why you should stay tuned now. My name is Bridget Amadente. When we come back, I'll introduce my guests and then we shall get started.
Hey, Cisco, Microsoft.
You're welcome back from the break. If you just joined the conversation, as I said earlier, we're discussing healthcare delivery in Ghana, lessons from the COVID-19 pandemic. And today, my guest is all the way from UK. His name is Dr. Joshua Ajilinko. He is a general surgeon in training in London, and he has a lot of information to share with us with regards to healthcare delivery and the nature of the pandemic, from where he's coming from, and for those of us here on the African continent. Doctor, you're welcome.
Thank you so much, Bridget, for having me.
It's a pleasure to have you today. How was your flight? Let me be nice.
It was okay. I've been in the country for about a week now, so
okay.
I've had a chance to explore a bit more.
I see. I hope you're eating Ghana and feeling Ghana.
Yeah, very well so.
And how was the testing like at the airport?
Oh, it wasn't that bad.
It wasn't that
it
bad.
took, I think it took about half an hour from the time I got off the plane to me getting out to see my family and my friends, so it was fine.
Okay.
Yeah, better than we all hoped.
Okay, thank God for that. So we are going into today's discussion and we are discussing healthcare delivery in Ghana, lessons from the COVID-19 pandemic. So the COVID-19 has exposed a lot of the weaknesses with regards to healthcare delivery in a lot of economies and countries and stuff like that. But when we talk about healthcare delivery, what exactly is it and what are the elements that come together?
Sure. Okay, so thanks for the question to start us off, Bridget. So I think, as we all know, one of the key aspects of any developing country and also in developed countries is healthcare. And there's always the need for any government to place a greater emphasis on how it affords healthcare delivery to its citizens and to the people. So I think I'm very pleased to be on the show to discuss such an important topic. I think when you look at healthcare in general, there's something called quality assurance processes. And I think without these indicators, you can't actually start to discuss how a healthcare system should function and to function properly. So there's a gentleman from Denmark called Mice. So he came up with the triad of indicators for running an effective healthcare sector. So it's to look at the structure to start off, to look at the processes, and then to look at the outcome. So if we're to use, for example, patient safety, if you look at the structure, so you might consider, for example, we want to, reduce problems and issues with surgical problems or surgeries going wrong in theatre. When you then look at the processes, you have to think, so what do we need to think about to ensure the aforementioned statement? So you need to then think about, using the World Health Organization checklist, which a lot of countries adopt to make sure they're not making any mistakes. Everyone in the room is aware of what the operation is going to be, and then the patient undergoes that operation successfully. And then you look at the outcome. So the outcome will then, be based on what your structure and processes were. So essentially, you make sure the patient is safe and gets out of theatre and functions properly afterwards. Another way of also looking at it is what we call the Dobedian approach or doctrine. So essentially, you look at two things. So there's always the generic processes and the disease-specific processes. So the generic process, for example, a patient comes into a hospital door, and regardless of what they have, they might have a headache, they might have stomach pain. These are the processes they go through to ensure they receive adequate healthcare. But also the disease-specific process will be, for example, a patient with a lump. These are the quality assurance processes and the steps a patient goes through. So you're able to, if the lump is suspicious for cancer, you're able to take them out. And if it isn't, the patient doesn't undergo unnecessary operation. So those are the two ways of thinking about it. The third way of also looking at it is to split it into patient factors, the physician factors, and environmental factors. Okay. So the patient factors will be, socioeconomic variables. So that can include, where they're from. So for example, if someone is all the way from the northern part of Ghana, they're mostly susceptible to, patients who, or physicians who are actually from that part of the grid. There are lots of studies actually to say that even in childcare and mortality or childcare service provision, a doctor who is, for example, Afro-Caribbean will be more able to understand all the socioeconomic factors that the patient or the child will be telling them. So that's always important. You also have to think about also patient cooperation. Mm-hmm. So, and again, that's also built on what I discussed as well. If a patient is likely to listen to what the physician is going to say, that can also go on to ensure that the patient listens to them properly and takes on board and is compliant with everything that the doctor says to them. And then when you come to the physician factors, then you have to think about, how liable is the patient in terms of the relation with the physician. So for example, if the patient knows that this doctor is listening to me, what we call the doctor-patient relationship, as opposed to the old paternalistic approach where the doctor says everything and then the patient just takes everything on board. It doesn't always foster, good outcome between the two. But if there's a shared decision making, then the patient is most likely to listen to the doctor, and then they get better subsequently. And then the third part, as I mentioned, is the environmental factors. So it all depends on the healthcare system that a hospital or any healthcare setup, be it public or private, that is situated in. So for example, we've got the NHIS, which is obviously a key component of service delivery in Ghana. So for example, if that system is there for patients and the hospitals, then depending on wherever you're from, whether you're poor or rich, you should be able to at least get some form of healthcare delivery. So those are the three main things that we should be looking at to ensure that we're able to adequately measure the healthcare quality in a country.
Okay, so with regards to structure, process, and outcome, how does maternal mortality play a part? How does life expectancy, how does neonatal child birth and death and stuff like all those indicators, how do they play into these three structures you have just mentioned?
So again, very important. Again, very important question that you've asked. So when you think about the structure itself, you can think about the number of beds, for example, in a country, or even if we use Accra, where we're discussing this important topic now, how many beds for children do we have in a system? So that if, for example, an under 5 patient goes to the hospital with suspected malaria, are they able to get a bed that day and be seen adequately? Which again is a challenge for every country, especially a developing country like Ghana. So that's how the structure should be. So we should be thinking about, in what context are we thinking of providing adequate healthcare to the under 5 or to the child. When you think about the processes, then you start to think, if beds is an issue in the country, how do we go about actually ensuring that we provide adequate beds in the system? So that could be not just the public factor, but also the role of the private factor, which is now becoming quite important in a pandemic such as the coronavirus, which we'll touch on. So again, those would be the processes, some sort of a link or a bridge between the public and the private sector, so that we ensure adequate beds for them. And the outcome will then be, the patients are able to be seen quicker, they're able to go home, they're able to recover quickly in hospital and at home, and everybody's happy, the parents seeing their kids getting better can then return to work. It then boosts the economy. So it's a gradual, systematic process that we should be thinking about.
Okay. So let me come back to Ghana here. The National Health Insurance Scheme was set up in 2003, and since then Ghana has marked remarkable health growth, like life expectancy, maternal mortality, and stuff like that. They have all reduced or increased at some point. But 2020, we have people reporting of instances where you go to the hospital and all you're given is paracetamol and an antibiotic, azithromycin. And then the patient is like, okay, I went there with a disease that I was expecting something more, but this is all I get. What is accounting for all of these? Should I say patients are not being really taken care of? Is it the fact that it's free, or is the fact that it's got to do with policies and stuff like that are inbuilt and systemic in the country?
Sure. Okay, so to answer your question, I must say, the NHIS has come in and, I can clearly count on instances where family members have benefited from them. For example, we always think about a healthcare system being in place, for people that can afford it.
Yeah.
So the NHIS, I'm sure, has come in and has made a huge difference to the lives of people in the rural areas. Whether you've got money or you don't, you can still go, and at least you get some form of treatment and you'll be looked after. It might not be the best treatment, but at least you can leave the hospital and then recover at home. But obviously, as you've said, there are issues and there are challenges with the NHIS, and globally there are lots of systems in place. The UK, where I practice, there is free healthcare for everybody. But even that, there will always be complaints from patients to say, when I went to the private sector, I was looked after quickly, and they ran all these scans to make sure, they knew exactly what was wrong with me, and then I was able to get better at home. So it's not, this thing is not just,
the private is all about your money, so they will do everything to ensure.
Absolutely. That. So yeah, so I went to Nyahom medical practice yesterday to meet a friend, and like you said, patients come in and the turnover is so rapid. They come in, if you have the money to afford, they will see you that same day and you go home. So the private healthcare sector has its role and importance in the system, but as you said, the NHIS, I'm sure, is benefiting people. The problem with the NHIS is, the system can get a bit overwhelmed, because everybody wants to make use of that, and that can make it difficult for the healthcare professionals providing the services to provide the same method of treatment for everybody. And as I mentioned earlier, one of the problems with measuring healthcare and the quality of it is the fact that it's intangible. So you can't physically touch it. It's not goods and services. So it makes it difficult for the government to even monitor how well the NHIS is doing. Because you come today and it will be a different nurse that looks after you. Another person will go. So you don't know how well the system is benefiting. But I think the way to look at or to move forward and to progress is to make sure that we actually go to hospital as patients, and this is a bit of a patient advice forum as well, is to make sure they are going for the right reason, because if every day you go to the outpatient department and people are going there with vomiting and diarrhea, I mean there can be serious causes of them, but most of the time it's viral gastroenteritis, so you don't actually need to go in to put pressure on the very few healthcare system, and we all know the ratio between nurses and doctors to patient ratio. So I think if we make use of the system properly, then everybody benefits. The stress levels isn't too much, and they get looked after properly. But I think also policies, as we mentioned, needs to also be put in place. I think the slight issue that I've noticed is not everybody contributes to tax in the system also. So it means that if you're contributing to the tax system, and it means you make use of the NHIS, and I am not, then it becomes a bit unfair. So I think from a policy standpoint, if the government is able to ensure that everybody is contributing to the national purse, then the motivation level in the system is high. Nurses won't feel this person doesn't contribute, so I'm not going to look after them.
But
Everybody.
then, come on, if they have a phone, they are paying some form of tax.
Yes.
Definitely, if you use a car, you're paying some form of tax. And even if it's not a lot, you're still paying tax in a way. And still, you're a human being. You are entitled to certain services that the government says they are offering. So really, it shouldn't be about taxes, because the taxes is not easy like that.
No, I agree. It's not. It's a complex.
It's not, it is. With regards to I've heard a story where a nurse, nurses in Ghana, they run shifts and stuff like that. So when a nurse's shift ends and maybe you're taking care of a patient, instead of ensuring that the patient is fine and then he or she has gotten to the point where he or she needs rest or something like that, immediately, let's say it's 12 o'clock, I have closed, my shift has ended, so I'm going, leaving the patient there. That is another issue when it comes to health. And then there are instances where people also say that doctors and nurses are not being passionate about their work. It's as if they want the prestige that comes with being a nurse or a doctor, but not the work that comes with it. My question here is, are we really training them well in their schools to be churned out into the hospitals to take care of us?
Again, you're asking very important questions today. So I think, as doctors and healthcare professionals, you sign to take care and look after patients. So we should all absolutely so. And we sign by the Hippocratic Oath to say, I'll look after the patient no matter where they're from, no matter how much money they make.
I see.
So that should be, that's what I believe in. And, that should be how every healthcare professional should see things, so that they're able to act in a balanced and a fair manner. As you said, is not ideal, from hearing these stories of, unfortunately, nurses and doctors vacating their call of duty and going home as soon as it hits the time they should go. I think if you look at the job as if, it's a job that you put human beings, the lives of human beings even first, then you won't be doing these things. You're always thinking about, what if I leave and the patient, passes on, or even if I leave and then I come back and the patient's condition has got worse. So I think as healthcare professionals, we should always think about, the greater good rather than, just financially and the prestige that comes with it. Because I can confirm, the prestige actually disappears the longer you work, because it's not actually as glamorous as it can be looked on to be. So I think it's just making sure we always put patients' lives first.
Okay. Look, we're going on a break, and then when we come back, we can zoom into lessons from the COVID-19 pandemic, and then we can compare the instances from landing and then from Ghana. It's going to be interesting. Please stay tuned. Continue watching on Facebook, Association of African Universities, and then on YouTube, Association of African Universities. I'll be back shortly. Welcome back. This is still Healthafrik on AAU TV, and we are discussing healthcare delivery in Ghana, lessons from the COVID-19 pandemic. And now we are moving to lessons from the COVID-19 pandemic. It hasn't ended yet. Yes, we are still in it, but then we have to learn and adjust and move on. So if you can keep watching the Healthafrik on Facebook and then YouTube and tv.aau.org. Doc, you're welcome back.
Thank you again.
Okay, so we are moving on to talk about the lessons that the COVID-19 pandemic has taught us. Prior to COVID-19, I mean, the healthcare system was there. We hardly talk about it. It was there, but the COVID-19 has sort of undressed all the challenges it has, and now it's standing there naked.
I think undressing is probably the right word here. I think it has definitely laid bare all the challenges that every country is facing. And let's be honest here, it's not just, we always think of just the developing countries struggling with the pandemic, but the West is also struggling as well. In the UK, for example, there's been a massive outcry on people getting tested and the long queues people have to go through. You don't get your results in time, and there's been over 100 healthcare professionals who've unfortunately died from the pandemic. Unless you're told this in Ghana, you wouldn't think. You would think it's all nice and rosy over there in the UK, but it's been a massive challenge for every country. So, and Ghana isn't exempt from it. And actually, from what I've seen in my week or so in Ghana, actually, I think the country needs to be commended for the work it has put in place. From higher up all the way to the grassroots. So. But like you said, there are challenges as well. I think one of them obviously is delay in patient seeking healthcare, and it means unfortunately diseases become advanced, especially the ones that are cancerous. Because patients do not even feel they need to bother a doctor. They feel, oh, this will go away, and then by the time services are open, by the time you've then gone to see the doctor, things unfortunately have got worse. And I know of stories of colleagues, friends who, unfortunately, diseases of the breast have all got worse, in that era. And it's not even been that long, so you can imagine the problems that they're facing and the trauma psychologically as well. So that has been a problem as well. The other problem is also financially as well. We live in a system where obviously money is important. It runs everything that we do. So if patients are not going to the hospital, it could be because people have been laid off work, they've been unemployed, they're not getting the means, so they won't go and spend that money. They rather spend it on food than to go and see a doctor about a headache that they think might go away. So then the hospitals are suffering, the smaller clinics are suffering. So I think it's a complex cycle that is affecting every healthcare setup in the country, unfortunately.
Okay, so I'm sure that the public sector or the public hospitals have their own challenges, and the private hospitals also have their own challenges, because, as you said, surgery cannot take place. While there was lockdown, surgery wasn't taking place because they were scared of, the whole process. You don't know who has touched what and bringing it to the body being worked on. So, what differential challenges does the public sector face, and what differential challenges does the private sector face?
Absolutely. So, as you mentioned, challenges are being faced by both the public and the private sector. So, I think from a public sector point of view is how overwhelmed their services can become. So rather than just making sure a patient comes to the hospital, now you're thinking about measures you need to put in place before the patient even enters. Do we have appropriate sanitation processes in place? Have they got face masks? If they haven't got it, have you got it at the door? For the patient to use. So, unfortunately, if they have the virus, they don't go ahead and infect people. So that's been the main problem for them. And there are a lot of public sector services who are suffering if the government hadn't injected some money or some financial support into what they were doing. Whereas on the other hand, you've got the private sector who are struggling because they're losing patients. No one wants to go to the hospital to spend money if they don't necessarily need to. So I think, like you said, there's a differential impact on both the private and the public sector.
Okay. What have we learned from the pandemic, and how are we making, the healthcare system better, the lives of people better?
So I think one thing I've definitely noticed is the advancements in technology. Now you don't have to physically go to the hospital to see someone, or even educational platforms. And so I'm part of the Ghana Doctors Association in the UK, and part of the educational committee. And we every couple of weeks or so we arrange different chats also. It hasn't started yet, but we're planning on starting that. But it means you don't have to go to someone's home to do it. You can just sit over, with your cup of tea or coffee or meal or whatever you enjoy, and then have a chat with them on, how best to improve our skills, even in a time where we are not getting to practice as much medicine or surgery as we would like. So I think that has made a huge impact. And, there's now also improvement in access to healthcare as well for people that necessarily couldn't go to the hospital as well, especially if confidentiality is ensured. You can sit over your phone or Skype or Zoom and just talk to your family doctor, and then they'll give you an instant advice, and then you can move on. There's also been lots of online chats sites that have come up as well. Some private, some public and non-governmental organizations, which again is to try to bridge the gap between the patient and the secondary service. So they act as an intermediary or a primary care setup to try and help. So there's been a huge change in that from that point of view.
Okay, I'm yet to see a telemedicine app that is free, because I haven't seen one, at least not yet.
Okay.
I'm yet to see one, really. I'm really yet to see one, because I know there's a lot of it online, but it's not free, because the doctor they also needs
to make something as well. But we're trialing one actually.
Really?
Yeah. So with a group of doctors in Ghana, in the States, Canada, and the UK, and there's about almost 300 of us now.
Wow.
And so we are in the process of discussing with the appropriate bodies here to ensure. And once it becomes champion, they will be free of charge for patients to access that as well.
24/7, or you have a specific time?
So the aim is to make it 24/7 and to try and connect, different ailments to the appropriate specialist and to try to help. As you said, there's not many, free or any free ones around.
There's nothing like free.
So I'm sure I'll keep you updated once that becomes available.
Yes, we'll be glad to know that and to feature that on Healthafrik. Yeah, so let's move. We're wrapping up here, but I want to know the impact of all of this on patients' well-being, because, for instance, myself, when we were during lockdown, during the whole process of lockdown, I remember I had a headache. My head just kept aching every single day. I'm like, go to the hospital. I'm fine. What's happening? What if I just go and touch a table and then I have COVID-19? Like, I just won't go. So you've even mentioned the fact that people wouldn't go to the hospital, but what if it advances and then we lose lives? Whom are we going to blame?
Unfortunately, your experience is not, it is not peculiar. So I think a lot of patients are having the same problems or facing the same challenges. I think the main impact has been, from a mental health point of view, and like as I was saying, backstage with you earlier, here the society is an open system, so you could easily get in a car and go and see a friend, and then have a chat, and then you're fine. Unfortunately, most systems where, especially in the UK, everyone is in their own bubble, so to speak. So it means if you have a problem, you're not able to share it with your neighbor easily. So that can have a big impact on patients and people's mental health, especially patients with already existing mental, there might not be many services around now. Some are closing, or some are laying people off because of financial implications. So, but there are some still around, and I will encourage everyone to tap into it if they feel their mental health is being affected.
Even issues of domestic violence. Imagine during lockdown, you're at home with your violent husband. 3 months, really getting beaten every single day. No, that would be very bad. By the time lockdown is over, you're dead.
Unfortunately, so.
Yeah. So let's talk about the role of leadership to help improve healthcare delivery in Ghana. There are a lot of, bodies that are supposed to take care of our healthcare in Ghana. But what leadership style are they using, and how is it supposed to improve our health when it comes to healthcare delivery in Ghana? So we talk about innovation, then finance. Very important.
Sure, absolutely important, especially in this era now. So I think to answer that question, we need to get a clear understanding of the difference between management and leadership. So management is actually the processes you need to achieve the leadership's vision. So you can set out to say, I want to improve healthcare access in Greater Accra region. You have to then manage or mobilize certain principles and quality assurance processes to achieve what you intend to do, or what, as a leader, what you feel is right. And I'm pleased to actually note lots of innovative ideas coming up, to try and arrest all the challenges and the problems that have been associated with the COVID pandemic. And I think as colleagues in the healthcare profession, I think that should now be the aim. We should always think, this worked before COVID, but this will not work. So let's see how best we can go about things to improve that. So I think, as a leader, you need to be thinking about all the processes at play. It can be complex, but the other thing is always to also see if you can network as much as possible. Because as there's a saying in this country, 2 heads is better than one. There will always be things that you don't think about, that someone will prompt you, and you say, oh, okay, that will work. Let's see how we can expand. And sometimes it's only a small idea, but you can then expand it to help. And if it will lead to patient safety in the long run, then it benefits everyone in the system.
So my final question will be, what do you make of the amalgamation of traditional medicine, otherwise called alternative medicine, and the normal medical practice that we have? Let's say you go to the hospital and then the doctor tells you, okay, go and buy a traditional or an alternative drug. Do you think we can ever get to the point where such an incident will happen, that you go to the hospital and they tell you to go and buy a traditional medicine because they feel the one will work for you, looking at certain things they have taken into consideration?
Okay. I think one word will come to Bridget, and it's evidence-based. So you always have to have at the back of your mind what the doctor is telling me. Has it been approved by all the national, for example, in this country would be the Food and Drug Association or agency. So different names for different boards that accredit all these medications that come out. So that's what the patient and the doctor should be thinking of. I mean, if we think of acupuncture, which was trialed to help with chronic back pain, they've definitely made an impact on reducing the level of pain that patients were coming with, even better than the paracetamol and all these neuropathic pain medications we get given by doctors. So there is an element of, or there is a way of introducing them into the system, but we need to be quite careful, and we need to make sure there's proper research which has been done on these products. And finance is always a problem.
Exactly.
So it's about engaging some of these non-governmental organizations to try and see if they can put money into some of these medications, because if they work, they will actually help in the long run for patients. It means you've also got options. A patient comes to you and you just don't keep giving them the same thing. And also, I like as you actually use the word alternative, so that's how we should be thinking of it, not just traditional or herbal or other means of.
Traditional herbal makes it scary.
It makes it scary, exactly. It makes people think, oh, I don't want to touch this thing. So, but alternative is probably the right way to describe it. If it's evidence-based, then I think I'm all for it to be used.
Thank you so much for showing up. We thoroughly enjoyed this conversation. This has been Healthafrik on AAU TV, and we have discussed healthcare delivery in Ghana, lessons from the COVID-19 pandemic. COVID-19 has undressed all the problems we have in our healthcare system. But then the healthcare system has the responsibility of combating illnesses and ensure that the population receives the best form of healthcare and ensure longevity. You should look at the hospital you attend, and you know what? If you ever have any issues, just go to the hospital and trust the doctor with your life. He or she is going to take care of you. Thank you so much for staying tuned. This has been Healthafrik on AAU TV. My name is Bridget Amadente. I'll see you all next week for our Women's Health series.